Welcome. Ito vamos a tomar deseo.
My name is Gomercinda Alvarez de Surco. I live with my husband Daniel and my 3 children in the mountains of Bolivia, in a village called Carabuco at the edge of Lake Titicaca. Our home has 2 rooms. We sleep all together in one, and I cook in the other. Today is a normal day. This morning I am making breakfast. I am toasting barley. We grind it and eat it raw instead of bread. Most of what we eat, we grow ourselves, especially vegetables, wheat, and barley. The pool in front of our house is filled with dirty water. We use it to wash dishes and to wash clothes. We have to carry water for drinking and cooking from a cistern about a mile away. The children mainly help with the animals, feeding and herding them. But they also help with the cooking and harvesting. Edgar and Rinaldo go to school, and for this we must make sacrifices, because we have to buy the things they need. Sometimes I make sweets to sell in the marketplace to buy books and paper. Sometimes Daniel travels to La Paz to buy fresh fruit from the tropics. He brings it here to sell or trade for fish or grain. This is how we manage to buy a few of the things the children need. We hope our children will study so they can improve themselves and our pueblo. Still, I don't think they will grow up to live in the country as we do. Things are changing. People who study are all going to live in the city. The project is very important to our community because now, when we become sick, we have help close by. We have never had that before. And I have learned in Mother's Club classes how to prevent illness and how important it is for the children to be vaccinated. Yes, I remember before the project came, many children died, especially the very young ones. The project has helped our community very much.
Curamericas Global uses a unique approach known as the census-based, impact-oriented methodology to improve the health of families and communities.
For over 20 years, we have been providing services in areas where no one else has been providing services, and then helping communities to secure the resources to make those services permanent.
My name is Alberto Aldo Mendoza. I have served as a health worker for many years in the region of Aguascalientes. Health workers are vital to the project and the community. I, like all the people who live here, am Aymara. It is difficult to establish a relationship with the community. When the health worker comes from the place itself, the people have more trust. Where there is trust, everything works out. Most of the work we do is through regular home visits to the family. We call on every family once every 3 months. We keep careful records for every household. This home visitation approach is part of the census-based, impact-oriented methodology that makes us different from many other healthcare programs. The largest obstacles preventing adequate healthcare in Bolivia are geographic and cultural barriers. The most difficult part of my work is going from one house to the other when distances are often very great. The most satisfying part of my work is that I've been able to save the lives of people in my pueblo. Most of what I do is preventive education. We give vaccines to the children in the homes, and we also give educational talks to their families. We provide prenatal checkups to pregnant women and give vitamin A to the children. The greatest threat to the lives of these children is diarrhea and acute respiratory infections. We educate the families about how to prevent and treat these illnesses that are among the main causes of death for my people. We teach them to weigh and measure the growth of their children and how to prevent dehydration from diarrhea. One thing we do to benefit the community is teach health volunteers. Curamericas Global seeks active community participation throughout the planning, implementation, and evaluation process.
The whole notion of working with communities, empowering communities, building them into a partnership relationship with a healthcare provider offered tremendous potential for health improvement.
My name is Lydia Sebastian Martin, and I would like to welcome you to my home in Santo Domingo, Guatemala. My husband, our child, my mother, and I all live together in our one-room house made of adobe. On our land nearby, we also grow, harvest, and dry coffee beans that we are able to sell in the city. As the price of coffee gets lower and lower, it has become harder and harder to make enough money to survive. We manage by also growing fruit that we are able to sell or trade on market day in our village here in the mountains. I wake up early in order to wash clothes and prepare the morning meal before I go out to the fields to pick. The birth of our son has been such a blessing for my family. Previously, we had 3 pregnancies where the child died at birth or shortly thereafter. It was then that an organization called Curamericas started working here in the mountains. Their nurses came and talked with us. They helped us plan for the next pregnancy, showed us what to do in an emergency, and even were there on the night of my son's birth. They have continued to be involved by teaching me how to care for my child and how to improve his diet. They provide regular vaccinations for him and give him vitamin A supplements. We are so grateful for their dedication and the hope that has come with their help. They continue to help us plan for the future of our family.
We provide health education